All right. Well, thank you and welcome everyone for coming today to the Idaho Immunization Coalition webinar, our Survivor Series. Just want to thank everyone for participating. We're going to wait just a couple minutes here as we let people log on and get started. We want to thank our wonderful speakers who are here today and our great partners over at the Head and Neck Cancer Alliance for helping make this possible. So we'll just give it just a quick minute, and we have more participants logging in. And we're just so excited to have everyone here. So, all right. Thank you everyone for coming and joining us. We've had more participants log in. I'm Heather Gagliano with the Idaho Immunization Coalition. Really excited to have everyone here today and participate in our Unseen Battles webinar series. I really appreciate our wonderful speakers who are participating and sharing their personal stories and information with all of us here in Idaho. Today, I'm going to have you put any questions you have in the chat box. Go ahead and throughout the speakers as they're talking, go ahead and write information, questions that you might have in the chat. We aren't going to necessarily address them while they're speaking, but we will take them at the very end. But please utilize that chat function. We're really appreciative of the Head and Neck Cancer Alliance. Mari, if you can go ahead and provide that link in there for making this presentation possible and helping work with the speakers today. So today I'm really excited to introduce you to Christina Billmire. She's a U.S. Navy veteran and a survivor of tonsil cancer who's currently living in Sutter Creek, California. We have a link to her entire bio in the chat, so please read that amazing bio there, along with Thomas Bennett, who is a husband, father, owner-operator of Bennett Associates, and an HPV-attributed throat cancer survivor. He currently resides in Mount Pleasant, South Carolina, and really we'll also have his bio linked into that chat and a wonderful bio to read through. So please, I encourage all of you to take the time to read both of those bios. We also have, speaking kind of on that medical side, a couple of pharmacy students. So Sarah Kreshisnik is a third-year Idaho State University College of Pharmacy student. She's completing her fourth year of pharmacy in Reno, Nevada, and takes interest in infectious disease and emergency medicine. In her free time, she enjoys reading and taking walks in the foothills with her dog, Blue. We also have Tanner Tracy, a third-year pharmacy student at the Idaho State University. He completed his Bachelor of Science in Health from Boise State University prior to joining the PhD, the Pharmacy D program, and is passionate about patient interactions and the value of giving everyone the information so they can make health decisions that are best for them. So with that, go ahead, Christina, I'm going to let you take it away.
Thank you, Heather. Hi, everybody. I'm Christina Billmire. Like Heather was saying, I'm a U.S. Navy veteran, and I'm a survivor of HPV-attributed tonsil cancer as well. My journey began in 2020 at the height of the COVID pandemic. I took a shower, I found a lump on my neck, and I thought, what is this? Didn't really pay any attention to it. Contacted my primary care doctor. I went in and told her, hey, there's a lump here. I figured it was my thyroid. We all didn't have any pain. The only pain that I had associated, that this ended up being associated with, was ear pain. And this ear pain was 3 to 6 months out. Okay, fine. So then my doctor sent me to an ENT and a hematologist and so on. And I wasn't getting any answers. So I'm a firm believer in that you got to follow your gut. So I sought a second opinion, and I ended up at Stanford Cancer Center in Palo Alto, California. This was in October now. From July to October, I finally got a diagnosis that I had squamous cell carcinoma. Okay, I go to Stanford and I walk in that room and all the doctors and the team is there. And it was like, wow, I had this lifeline thrown at me because I finally had people, they were throwing so much information out at me that I didn't really pay attention to all of it until I heard the word HPV. that's when my oh my God moment occurred. Because back in my early 20s, well, mid to late 20s, I had an HPV outbreak on my cervix. I cleared the virus, went through the normal paths every 3-6 months yearly on, no problem. I got married, had children. I even had a hysterectomy, and I thought, yes, no more cervical cancer worries. Great, that's what I thought, right? Well, then in 2020, when this cancer struck me, and being at Stanford, and they said, we're going to test for HPV. And I went, HPV? And I told them, I said, oh, I'm aware of that. And I told them the story of me having it on my cervix and everything. And then they brought up P16, P18. And I went, what's P16, P18? And those, of course, are the high causing cancer cells that bring the oropharyngeal cancers. So they tested me for that. And it turns out mine was HPV-16 positive squamous cell carcinoma. Immediately went into having a tonsillectomy. I was fortunate that I didn't have to have a neck dissection, even though I had the cancer in my lymph nodes. I ended up having 35 rounds of radiation, 2 rounds of chemo. And since it was 2020, it was really hard because it was very isolating for me. And I had no one to talk to other than family, but they couldn't come with me to appointments or be there for me for support. So I found the Head and Neck Cancer Alliance organization, got involved with information from them. They provided me with a peer-to-peer support person through the Emmer and Angel program. That was a godsend. That was like a second lifeline thrown out to me because it gave me someone to talk to who had the same kind of cancer that I had and what I was going through. I also have 2 grown boys, and my boys have been vaccinated for HPV. I highly encouraged it. They got it in 2009 when my youngest was 9 years old, and they've been vaccinated against it. And I highly recommend it for others. It's, you know, something that prevents this type of cancer. And if I can help prevent, I mean, if I can pass that information on to others about how important it is, then yes, you should have your children vaccinated. During my treatment and everything, as I was going through it and having the support I had, I also found other ways to cope by, I'd go back to the waiting room where I would wait for my treatment and talk to others and say, hey, you know, how you doing today? And kind of get them to talk about what they were going through. Even though it wasn't the same kind of cancer, it was still cancer. You know, everybody goes through cancer at different levels or different kinds, but they said the same thing, that they were alone and they didn't know where to go. So I try to help them with getting that information and being proactive and doing that. And that's where my drive started, with trying to help others be more informed and get more information on things. And when it comes to HPV, a lot of people are hesitant about talking about it. You know, I mean, I don't know how I got it. I mean, I wasn't a bad person, you know, or a dirty person or anything like that. It just happens, and everybody can get this virus, whether they know it or not. But when I got it, there wasn't any vaccinations back then. And it would have been great if there was, because then I probably wouldn't have this cancer. So, you know, I hope people realize the importance of it and the fact that it's a good vaccine and a tool to have. But once I got through treatment and everything, I got more involved with the Head and Neck Cancer Alliance. And what was one of the things that struck me that I thought was really odd was, gosh, how come this cancer doesn't have any recognition for fundraising or doing things? Well, the following year is when they first came out, did their first move-a-thon, and that's how we raise awareness through the move-a-thon as well, for screenings, or you know, with dental screenings as well, because it's usually through the dental community that they can find these types of cancer. And the move-a-thon is a good thing to bring awareness for everybody to be involved, as well as just to participate. You don't have to necessarily fundraise, but it brings awareness and gives people the information they need and where to go. So, you know, I was I'm very fortunate because I only had an early stage cancer. But it's cancer's cancer. I don't care what anybody thinks. And when you're going through treatment, it's not easy. It can be rough, and when you're alone, it's hard. But I am now 4 years, almost 5 years out. I've hit my 5th year anniversary of no evidence of disease in December. So, you know, I'm grateful, and I've been blessed for having this opportunity to share with others and get information. because even though bad things happen to us, we're much better than that. And, these things bring us together and make us connected in ways that we didn't realize until something happens. So, Tom, turn it over to you now.
Oh, well, thank you. Thank you. And God bless you on your journey so far. I guess I'm the other poster child. So I'll talk a little bit about my diagnosis. I'm 10 years out, so I'm on my 10-year anniversary this year. But I was 51 years of age, running my businesses, and one day I was shaving, and I just had this one swollen lymph node, and I'm like, wow, that's weird. I had been doing some work and thought maybe I got some sort of sinus infection of some sort. So I went to my general practitioner, and she gave me the quick diagnosis. Oh yeah, that's what you got, and gave me some antibiotics, and I took them, and as we could tell you now, is those didn't work. So I waited a couple weeks and then went to my dentist, and he was a little bit concerned. He goes, "Well, you know what? I want you to go to an endodontist." I'm like, "Really? For what?" Because he didn't say anything about HPV cancer. He just said, "I want you to go see another doctor." So I went to go see an endodontist, and that checked out okay. Maybe I had an impacted tooth of some sort. And then I, at that point, made a decision that I should go see an infectious disease doctor, thinking maybe it was Lyme disease. I'm originally from Connecticut, and although right now I live in Charleston, we do have obviously an issue with Lyme disease. So I thought, let me go to an infectious disease doctor, and he did the whole thing and put me in some anti-inflammatories and some other stuff. But I still followed the protocol of my dentist, and I'll come back to that in a second. So then I had a maxillofacial scan done, and they didn't see anything. And then the typical protocol at this point would have been, as he had mentioned, was to go to an ENT. So I was still seeing the infectious disease doctor, and I was still seeing the ENT, or was had the appointment scheduled with the ENT. So I went to the ENT. They put the scope down, scribbled a bunch of notes, a lot of going on, a lot of camera action. I'm like, oh, okay, well, this seems pretty impressive here. And all of a sudden he handed me a piece of paper and said, you need to go see one of these two doctors at Yale. If you don't get an appointment within 2 weeks, call me back. I'm like, whoa, it's pretty scary, right? So, long story short, the angst of waiting for that appointment, and still asking myself, well, wait a second, why do I have to go to Yale? I mean, infectious disease doctor, how come he didn't pick up on it? In fact, the infectious disease doctor looked at my CAT scan and saw and read at the bottom of the film, or whatever you call it these days, that I had a tumor at the base of my tongue. And for whatever reason, he infectious disease doctor didn't pick up on it. So long story short, the ENT, I called Smilo Cancer Center, and then they had kind of told me, oh well, like, we don't panic, sir. We do teach benign cases, or we do treat benign cases here. I'm like, okay, okay. So then the big folder comes, and then you know that this is getting serious now. So I go in to see the ENT at Yale. He already has all the data. He knows. He goes, and he puts the scope down. He goes, well, I got good news and I got bad news. The good news is you likely have, he didn't say at that point, it's very likely you have an HPV related cancer. The good news is it's very treatable, and we believe it's curable. I'm like, wow, well, that's great. He goes, yeah, it's just some chemo and radiation. And this is the part that maybe Christina didn't go into depth about, but I'll just stress this because, again, I'm the poster child. Is that I had was elected to go into a clinical trial, which was only 6 weeks of radiation versus Christina's 7 weeks of radiation. But I also had 6 weeks of chemotherapy. I don't know what chemotherapy you had. Had cisplatin, one of the oldest forms of chemotherapy, goes back, I think, to the 1800s. I don't know. So think about platinum and radiation. It's a great combination because for me, I went in and started the treatment. And the first couple of weeks, they tell you it's kind of the honeymoon period. You're kind of still eating. You're still going okay. Then I had this wild dream about a strawberry, like a huge strawberry. I didn't know, my brain was already telling me that I was going to start to have this food aversion, which means basically you eat something, it's supposed to taste like a strawberry, and tastes nothing like what it is. So your brain says, spit it out, spit it out, spit it out. So if you could imagine for the next, I don't know, 12, 14, 15 weeks, everything that you think is going to taste like that, it doesn't. And so now you are in the battle of trying to keep your nutrition, trying to keep the weight loss off, I had a nutritionist, and they're like, if you don't maintain your weight, we're going to put you on a feeding tube. And my particular oncologist said, I don't want you at a feeding tube. And the reason why I can tell you that you don't want you to feeding tube is, as an ambassador, I actually mentored somebody through 7 weeks of chemo and radiation, and he was like a martial arts guy, and it banged him up pretty good. So, with that said, the strawberry is an important focus. So I try to eat strawberries at least once every couple weeks. So I go through my treatment, and then basically, um, I'm not necessarily clear yet. I haven't been given the clear thing, but with that swollen lymph node that I had, it was still a little bit large. So in contrast to Christina, I actually had to have the neck dissection where they went in and did a dissection of the neck. They did take out, I think, a chain of about 20 lymph nodes. And fortunately, she was right. I mean, I still had a little bit of cancer left, and so they got that out. And if you haven't seen the neck dissection, you have tubes hanging out of your neck for like a week and all that. But long story short, I came out of treatment. You're very, very tired. In contrast to thinking that chemo, although it is a treatment, in contrast to antibiotic, you don't feel better at the end. You actually feel worse 2 weeks after your last treatment. So it's kind of like you're depressed. You're kind of like, I want to get going, but the body is very resistant to a lot of that. So I was very active, golf, worked, done a lot, and so there was a long period of time to come out of that. But the one story that I like to share with it is because I'm a golfer, and I don't know if I had told Heather this story or whoever I told the story one time before, but I had the opportunity. I said I got to go play golf. So it was a cold, chilly day here down in Charleston, and I went to play golf, and I was just playing by myself, and just all of a sudden I came up on a dad and three boys. I'm like, oh, interesting. Like, hey, you want to? I'm sorry, a father and two boys. So it's four of them. I said, hey, you want to come play with us? I said, no, no, just go ahead. I'm exhausted, but I'm trying to get through my 18 rounds of golf. It's a mental thing I get through. So finally, no, no, come up and play with us. It was a par three. Now I don't know how many golfers we had, but a par three is a short hole. It's not a long hole. It's a short hole. But remember, I'm weak. So I grabbed my driver and said, no, no, sir, this is a par three. You don't want to use your driver. I said, boys, I'll tell you in a second why I need my driver. But the good news was I hit the ball. I actually got it onto the green, and it was a pretty impressive shot. And so then when I got to the green, I said, guys, this is an important message. The reason why I used my driver was I had gone through a cancer treatment, and I'm very weak, and I needed the driver to get on the green. But my encouragement at that point was that because I had an HPV oral cancer and there is a vaccine that's available, I encourage the father and the boys to reach out and consider the vaccination. So that's kind of my story. I think I was a little bit on the lucky side, and a couple things I do need to point out is that there are still concerns that the front end providers are still not necessarily that well. I don't want to say educated. That's not really fair because doctors are really well educated, where their dentists are, but they're not maybe informed enough about that of the screening and the one swollen lymph node. And I get calls from, I'm 62 years of age, or going to be 62. So I get calls from buddies who get symptoms sometimes. I'm like, no, one swollen lymph node, I'd be concerned. Two, you're okay. But certainly as part of being an ambassador and helping people through treatment with some encouragement, as Christina had mentioned, maybe locking into that right food and just eat it till whatever. I'll tell you this is a weird story, Um, a friend of ours was a radiologist, and she said, the best thing you can do, I don't know if you did this, Christina. She goes, after your treatment, put honey on the wound because you when you radiation down here, it's raw. It's raw. I'm not telling you it's like I don't know how it's raw. But your throat is raw. Mine was in the base of my tongue and it was raw and it hurt. And I had to go on oxy. I don't know if Christina, if you go on oxy. I had to go on oxy for about, I think, 7 weeks, 6 weeks or so. And
Gabapentin was mine.
that put me in, like, I don't watch game shows. I don't play video games. I was playing video games, and this is a kind of funny story. It does make me laugh, and I'm here to share the story on the positive side, but I was down. I wasn't living full time in Charleston yet, but the doctor said, "Hey, go down there," and I went down there. So every day, for whatever reason, um, what's the show with the guy? Family Feud was on, right? So every day at 4 o'clock, Family Feud came on. So I'm playing this little video game, which I don't play video games. I'm playing this video because the oxy is in my head, right? And all of a sudden, and I'm watching Family Feud, and all of a sudden my wife goes, "Hey," and I'm eating nothing, maybe like a half a can of corn or something like that. So I'm eating nothing. She goes, "Hey, what are we gonna have for dinner tonight?" And I said to her, "I'm watching Family Feud." I was just a different guy on the oxy, right? And so I wasn't bad. I wasn't nasty. I just was a different guy. So finally, I felt the pain subsiding, and I decided I did. Fortunately for me, I did not have any addictive symptoms to the oxy. I bought some sort of withdrawal product from Amazon. I didn't even need it. So the doctor was aware. They weaned me off. I think it was a reduction of like 5 milligrams or something every day, and I didn't. Fortunately, the only symptom I had. Am I doing okay with time? The only symptom that I had was I had tears. Occasionally, I had like just I wasn't crying. I just had tears. And so that's kind of the story. But there's still, I don't know if you have any lymphedema, Christine. I certainly do because of my surgery. If I sleep the wrong way or I compress my neck the wrong way, I can kind of feel the fluids not flowing correctly. But I have my exercise. I went through physical therapy. I have that. There's definitely even I get a physical every year, and I do have my blood work checked every 6 months because the chemo that I had is not good for the kidney. So I definitely have my creatinine and some other work. But the doctor, especially this time, really felt the leathering. I don't know if you're doing Christina with the leathering in your neck. So you have to do these exercises every
Oh,
day to keep the
fibrosis too. Yeah,
yeah,
fibrosis is
fibrosis.
another
Yeah,
one. I have the fibrosis of my carotid artery
yeah,
around there,
yeah.
and other side effects that are still coming out. Dry mouth. We
How
all
you
have
doing with
that.
your? Did you
I'm
lose any
sorry.
salivary glands? I lost one salivary gland, so my
Yeah,
mouth
I
can be
I don't
dry
have
at
that
night. Yeah,
either. Yeah,
yeah. So
yeah, but you're right about the
uh,
eating and all that stuff. It's very difficult, and the leathering
yeah,
of the skin. I was fortunate
yeah,
though too that I didn't have to have the neck dissection, but the side effects are still there, and
yeah.
swallowing and all
So
that. But hey, could be
yeah,
worse.
yeah. So as you know, we got to take a little bit better. It was funny. The oncologist said, "Go and gain weight," and then you go back and you do these follow appointments. And she said, "All right, stop eating cheeseburgers. You're fine. Don't gain any more weight." So, but the other thing. I mean, actually, I haven't thought of it in a while, but there obviously are. I hate to say it this way. My oncologist, she was very good doctor. She was definitely a bulldog. And she basically said, "You're not going to die of this cancer. You'll die of some other type of cancer." So, with that said, I don't live every life saying it's going to come back because the likeliness of it coming back is very, very, for me, is from my diagnosis and from where it was, is very, very remote. Not to say it can't happen, but it's very
Right.
remote. But my daughter definitely had those shots. My son, he's 33 years of age. He's still, as they keep creeping the age up on the vaccine and the opportunity to tell, he's hasn't, and he saw me. I said, in fact, when I was diagnosed with it, I had this certain chair. It was my father's chair. I said, "Bring in the cancer chair." My father didn't die of cancer, but we had this chair that was supposed to be comfortable, right? It was a comfortable chair. It was the cancer chair. Because when I was done, that chair got burned. So, but
Oh,
anyway,
yeah, that's
I don't
amazing
see.
what we go through.
Yeah. So. But it's all good, all good. The only thing that gets me now is the aging process, so stay young.
Yeah, really.
Yeah. All right, I don't have any. Let me just check my notes here. So I'm 10 years out. The move-a-thon's coming up. Um, it's a great I think was really nice about the election of the move-a-thon is that it includes everybody. Even if you're older and you can't do, you can still. I think some people even knit or something. I don't even. As long as you
That's
can
right.
move something, and as long as you have a network of people that you can ask to support you in that, you can do it. So it's not like you got to go do a 5K. In fact, at one point I said I want to do a 5K, but my knees won't support that, which has nothing to do with my treatment, just playing basketball for a long period of time. But with that said, the Move-a-thon is, and you can go to the website and kind of check out what's going on. A lot of people work hard at raising money and the awareness, and so that's all. I'll close on that point. Let the next crew kind of hop in here and look forward to any questions at the end. So thanks for your time. Look forward to it.
All right. Hi, everyone. Can you hear me? All right. My name's Sarah, and I'm presenting today with Tanner. As Heather said earlier, we're both in our third year of pharmacy school at Idaho State University. And today we're going to be talking about human papillomavirus, or HPV, the vaccine that's available for it, as well as some techniques you can use for recommending vaccines in your practice. We do have a couple questions throughout our slide set that we would love your guys' participation in. So if you don't mind participating. Sorry about that. Okay, so to start, we're just going to give a little bit of background on HPV as well as its vaccine. So HPV is a commonly transmitted, sexually transmitted infection. Most infections are asymptomatic and transient. However, as we've heard from our speakers today, uncontrolled high-risk cancer-causing serotypes can go on and lead to cervical cancer, oropharyngeal cancers like the head and neck cancers, penile cancer, vaginal cancer, vulvar cancer, as well as anal cancer. And these cancers tend to develop decades after the initial infection. Virtually all cervical cancers are caused by HPV, and HPV is also the most common cause of the 5 other cancer types previously mentioned. So the current HPV vaccine that's available in the United States is the 9-valent vaccine, or Gardasil 9. It's aimed at preventing new HPV infections and HPV-associated diseases like the previously mentioned cancers, as well as genital warts. The current vaccine contains 9 different serotypes, including serotypes 16 and 18, which are the most common cancer-causing HPV serotypes. As Christina mentioned, she had one of those implicated in her cancer. It also covers serotypes 6 and 11, which are responsible for genital warts. It's important to note that the HPV vaccine does not treat current HPV infections, and it does not provide coverage if an individual has already been exposed to the virus. It also doesn't provide coverage from serotypes not included in the vaccine. So in the 2016 to 2020 in Idaho, we saw that HPV-associated cancers in Idaho were at a rate of 11.7 per 100,000, with the highest rate occurring in Public Health District 1 at 13.7 per 100,000. In this same time frame, we saw that HPV-associated oropharyngeal cancers were higher in males than HPV-associated cervical cancers in females, which this highlights a really, really important point that HPV vaccines need to be recommended to both males and females. So ACIP recommends routine HPV vaccination in 11 to 12-year-olds, with the vaccine being most effective if given in this age range. And that kind of goes back to what we were talking about earlier, is that the vaccine prevents new HPV infections, and most new HPV infections occur in adolescents and young adults, and generally occur shortly after an individual's first sexual activity. So if we provide that vaccine earlier in age, then there's a lower likelihood that they've already been exposed to the virus, and therefore the vaccine can be more efficacious. Vaccination can start as early as 9 years of age, and the catch-up schedule extends through 26. But as Thomas kind of mentioned, 27 to 45-year-olds are still eligible for the vaccine. And although it is more effective if given earlier, there is a chance that new HPV infections can occur with new partners. And so individuals at this age can still benefit from vaccination. Other vaccines that are recommended to 11 to 12-year-olds include COVID, flu, depending on the season, Tdap, and MenACWY. And this is going to be important in a little bit when Tanner talks about some techniques that you can use for recommending vaccinations. So just kind of keep it in mind. But how does Idaho look as far as HPV vaccination rates compared to the national average? As of 2021, Idaho HPV vaccination rates were at 47.5%, which was below the national average of 58.5% and far below the goal of 80%. But this average was up from 2016. So before we kind of move on to the next section of the presentation, I just really want to reiterate the efficacy of the HPV vaccine. 10 to 12 years after vaccination, the efficacy of the HPV vaccine is still above 90%. In the United States, there are 11,500 new cervical cancer cases and 4,000 deaths associated with cervical cancer in women each year. And so we have a really, really efficacious vaccine that can prevent HPV infections, especially if given early on. And so this is a really, really important tool for preventing these infections, as well as the 5 other cancer types that we mentioned previously. So as we move on into the next section of our presentation, we'll kind of present some different techniques, including the ARM method and the SHARE method for recommending vaccines in your practice. But before we do that, I just kind of want to open the floor up and ask all of you guys, on average, how long do you spend talking to patients about vaccines?
And I just want to let everyone know you can use the chat to provide an answer for that. While you wait for some replies, Sarah and Tanner, could you share a little bit about your personal experiences with talking about that? I know sometimes when we're in the clinic, it's a little bit different, you know, being in a community event versus being in the clinic is a little different.
Yeah, I think, Heather, as you know, so we have a little bit of a ongoing vaccine clinic at the Mexican consulate, and it's just in the same room as people who are going to get help with their like paperwork and whatnot. And so we have the opportunity to discuss with them a variety of vaccines, including HPV. And so it's kind of like a, you know, DMV setting where you're just sitting, waiting for your turn to go up. So we do definitely have a great opportunity to just discuss vaccines with people. I think a really important thing that I've noticed in that practice site is that there is a lot of trust between the interpreters and the individuals who are at the consulate. And that's a huge part of making recommendations as far as vaccines go, is having that trust. People can really they believe what you're saying, and they're much more likely to say like, okay, yes, I will get those vaccines. And so we can kind of talk to them about what vaccines they're eligible for. With HPV, depending on your age, you get either 2 or 3 vaccines. So we can kind of talk to them about that a little bit, as well as adverse effects associated with the vaccine, and then any hesitancies that they might have. I think something that's really important that was highlighted today is the power of telling stories. Just because you can see like it really does impact people's life. And this is what can happen if you do get infected with this or with this virus, and it becomes uncontrolled. And later on, decades later, you're dealing with complications associated with it.
Yeah, I also work with Sarah and with Heather at the coalition. And so every Wednesday we're down there at the Mexican consulate. And that one really is just getting to spend a lot of time with patients and just educating them on why you're recommending those vaccines. I think a big part, as Thomas and Christina both mentioned, is that people don't really have enough information about certain things to make the right decisions. So providing them with more than just a second and saying, hey, you can get this vaccine if you would like, and really going in depth about it is what makes them feel a little bit better about their decision, makes them feel a little bit more empowered and informed, so they know they're making the correct decision for themselves. So that's one thing that at least we're very grateful for. We don't have a time limit where you have to see so many people while you're there. It's really just, hey, go and interact with as many people as you can and take the time with each person. So we've been very beneficial in that regard to have as much time as we really need. Nice. 15 to 30 minutes is awesome to be able to spend that much time with people. What's the reason behind each criteria for 2 vaccines? Ooh, I guess Lori, for that question, is it the vaccine schedule for HPV as to whether or not you get, because it's a series, so it's always 2 vaccine doses. at a minimum, and then depending upon when you start it, so if you start it, is it after 15, then it's 3 total doses. I don't know if you actually know. Yeah, I say I don't, if that's what the question is, okay, yeah. We don't actually have that one off the top of our heads, but if you'd like, we can check in, find that one, and then our pharmacist here, Dr. Cleveland, who we work with, we can actually refer to him as well and get back to you guys with that information, so that way we give you a good answer.
Lori, I can email you information later. It has to do with how well the body produces antibodies at that younger age, where it's been shown to be more effective and that only 2 doses are needed. I know in the ACIP meeting that was originally planned, they were going to talk about reducing that schedule to 1 dose or 2 dose and things like that, which did get put on hold. So we can follow up on that one a little bit later. Thanks.
Thanks, Heather. Okay, so now we'll move on, like Sarah's mentioning. So we'll talk about a couple different methods for ways to recommend vaccines. So the first one is the ARM method. Both these ones for ARM and SHARE are acronyms for ways that you guys can easily remember about vaccine recommendations. So ARM, it's kind of a sequential order. So A is for act now. That's when if you have someone who is there in the clinic, then you're just going to go ahead and assume that, hey, you guys are willing to get a vaccine today. So it's when Sarah mentioned that they are eligible from that 11 to 12-year-old range. That's when it's recommended to get Tdap, then ACWY, HPV, flu, and COVID. Then just assume like, hey, you're here in clinic today. Let's get these vaccines done before you leave. Or while you're here, let's go ahead and get these ones administered, get that series started. So that way you just err on that side of assuming that they're wanting to get it done instead of saying, if you would like, we can get these done, because then that seems like, for the provider perspective, you're very hesitant about even initially recommending that vaccine. So really moving forward with that one and saying, hey, let's get this one done while you're here. Also, they do call out using inclusive language, like let's get this done today, or while you're here, we should get this vaccine, because really it is a patient decision. They don't want to resemble having a provider looking down upon them or telling them, you need this vaccine, get it, listen to me. It really is that open discussion. So utilizing language like let's, or we should get this done, makes it to where people actually understand, oh, this is a decision, this is a conversation. So that opens that door for them. And then also the recommends, that's that next part. It's providing that strong recommendation, kind of like for that act now talks about, but really just saying, hey, I strongly recommend you get this one. Here's why. And that's where you can open up that discussion about what the benefits are. Again, like Sarah mentioned, and then with Christina and Thomas, stories are a lot more powerful for people. They'll actually take away and remember a lot more from that than just giving them straight up statistics and numbers. So utilizing a story that you can either have personal in your life, or from our speakers today, just utilizing their testimonies to tell you about, oh, here is something that actually happens in the real world for people. And then at that point, acknowledge and respond is talking more about if the patients, what their concerns are. Don't just gloss over them and say, oh, that's not that important. It really is for this benefit. It's really understanding and listening to them, taking that time in order to make sure that they feel heard and feel like all their concerns truly are being addressed, will make them feel a lot more listened to and trusting of their providers at the end of the day. And again, restating that benefit to really just hammer home why this vaccine is important and beneficial. It is one of the only cancer preventing vaccines that we have. So that is huge. Definitely one that is super beneficial for people at the end of the day. And then their last part is motivate. So again, it's not sequential order. If you act now and say, hey, let's get this done, and they say, yep, let's do it. Great. I would still recommend saying, yeah, here's why you're getting it. Here's what we're trying to prevent, utilizing that information. But then if they're saying, no, I don't feel like we need this one, explain why they should get it. And then at the end of the day, it's motivate, where it's the patient's decision. You can't force anyone to get anything that they don't want to get, but motivating them, making sure that they feel like, oh, this provider does have my best interest at heart. That is what you're really trying to do, build that trust. And at the end of the day, your patient-provider relationship, that's more important. You want to make sure that you respect the patient, but each time that they're there, bring it up. It's a great time to have a conversation. As they feel a lot more comfortable with you as an individual, they'll be a lot more likely to listen to you, and they'll be a lot more likely to eventually get that vaccine if you just continually bring it up with them, talk to them about it, address those concerns again. So that's what the ARM method goes through. I think it's a really good, just sequential, easy one to remember. Each step seems pretty easy to utilize. So for this next part, you guys just want to put it in the chat. So just have a little patient case example. So you have TJ, who's a 12-year-old male patient. They come in with their mother to the clinic today for their annual checkup. Notice that TJ is due for his Tdap, first dose of HPV, and then the men ACWY vaccine. So utilizing the arm method, how would you go about that one? Really just be that first step for ACT. What would you kind of say to them? How would you address that one or even open that door for them? Yeah, also for sake of time for you guys, we will just keep going through. We'll have another one after the share method that utilizes the same thing, but really just thinking about how you guys could potentially implement that into your practice is really what would be beneficial for you at this moment. Okay, so for the share method, this one comes from the CDC. It's primarily used for flu vaccines, what they really call it out for, but it honestly works for any type of vaccine that you're recommending. So share, first part for S is share. So share why the patient is recommended for this vaccine based off of their age, based off of preventing different cancers and those things. So why you're recommending it to them, giving that information initially. And then for that H is highlight. So any positive experiences with the vaccines, tell different stories, talk about cancers that can prevent, talk about stories that you guys have heard today or anything that you might have personally that you know about for different patients. And then for A is address, just making sure that patients, again, have that opportunity to ask you questions and share what their concerns might be. So from there, you can help them understand what potentially they're misunderstanding or what information they don't have at that time. And then next part is remind. So remind them about the effectiveness. Like Sarah said, it's over 90% effective, even a decade down the road. So it's a super awesome vaccine. It's super efficacious. It does great things. It prevents those 5 most common cancers that she mentioned. And because that one, it really is a super beneficial vaccine that has no reason really not to give to anyone. And then for that last part is explain. So that one brings into the negatives of not getting a vaccine. So potential hardships and costs associated with getting an HPV infection, associated genital warts, or even cancer after that one. So like we've heard from our speakers, it's not just, oh, you had cancer and then now you're done with it. It's a long road. Once you get that diagnosis, going through that treatment, that course, afterwards, there's still different things that you recover from. It's not just a simple, oh, you had it, you're done with it. It really is a long lasting thing that sticks with people. So just reiterating, like, your kids are young. This is a great time to try and help them down the road for their future, preventing these different cancers and making that decision as early on as you can to set them up for success. So this one, again, that same case, just talking about the share method. So instead of just saying act now, it's, oh, share why they're getting that one, highlight what the importance of it is, address any concerns that could happen, and so on. So yeah, I think that really a big thing with both these methods is finding what works for you guys in your practice. Maybe pick and choose different parts from each of them. I know, like we were talking about the consulate every Wednesday, definitely do prefer that arm method of like, oh, hey, you recommend for these vaccines. Would you like, can we do those ones today? Get those started, explain what the series is. And then from there, if they have questions, really go into them, address them. But I also think that's important to remember. Patients all have different levels of information. So with share method, it gives a lot more information up front, which definitely can be beneficial too. So again, just picking and choosing from these. Don't think that, oh, I have to do it this way to give someone a vaccine. It's really what works for them and what works for you. So now we'll talk about concerns. How do you address those? What are common things that come up when people think about the HPV vaccine? So big thing is side effects. People always think, oh, I don't want a vaccine. There's these different side effects. And one thing that's really interesting with HPV, it's been commonly cited for syncope or fainting. People will definitely bring that one up pretty regularly. So we'll talk about that in a second, but that is a side effect that can happen with HPV. Also, local injection reaction. So any type of vaccine, injection, those things, really just soreness, swelling, tenderness, redness at that injection site, dizziness, nausea, headache. Those are also things that can happen. Really, this is with any vaccine. All those ones should just last about a day or two. Tylenol or ibuprofen. Recommend that patients move their arm, help out, stay hydrated. All great ways to combat that one. But again, it should only be transient, only last a little bit. So for parental concerns, things that get cited by parents most commonly, this is from a study that was a couple of years ago, but I still think that all this information is prevalent today. So first off, that they have lack of information about the vaccine. So this typically is that the providers will bring up a vaccine and just say, hey, you're recommended for this one. If they say no, that's the end of the day. So really giving them the information that they need. If they are saying no to it, you could definitely inquire why. Hey, did you know that this vaccine is associated with this? Just giving them more information to go off of than just a yes or no will definitely help out with that one. And for other patients also believing the vaccine is not necessary. I think that again goes back to that information. Just because if you don't have the appropriate information, then you might not think that this vaccine is really useful, beneficial, or even effective in doing anything. So sharing stories, letting them know that, hey, this one is extraordinarily beneficial for you. This is why it's recommended. Here's why it even exists. Make sure that they can use that moving forward with their decision. So safety concerns and side effects, again, addressing those ones. And a lot of times syncope, that's one that people are pretty scared about, but we'll talk about it on the next slide. It does happen, but it's not really just due to the vaccine. So the vaccine is not recommended. So again, bringing this one up and not saying you can get it, it's really providing that strong recommendation up front of, hey, you are due for HPV. Let's get that one done. That is going to be a huge way of getting that one for people. And then parents will often say also, my kid's not sexually active. As I mentioned, HPV is most commonly transmitted sexually active. So saying, oh, they are not having sex right now, so I don't need it. That is one that, as we've also mentioned, it's good at preventing new infections. So if you give it before they have any potential of contracting HPV, that's when it's going to work the best. It's going to be the most effective and actually benefit them. If you wait until they've already had an issue with it, then it's not going to prevent any new infections. It'll help prevent potential new ones that they could be exposed to later on, which is why it's still recommended later on, even though they may have been exposed to certain ones. But really early on is the best. Prevention is key in this one. So like I said, we'll talk about syncope for a second. It's actually really interesting. If you look at all the studies, it is noted that about 62% of all fainting events happen for patients that are 11 to 18 years old. So if you look, when is HPV recommended? It is right in that age range. And that is most commonly associated with also Tdap, Men, ACWY, and HPV. Those three vaccines altogether have the most commonly cited syncope events according to VAERS. So none of those vaccines share the same component. They're not due to any one individual ingredient within the vaccines. And so the reason why it's been most commonly noted for patients of that age range to have fainting events is due to a hyperactive vasovagal response. That's just due to stress. Patients get really nervous, really anxious about getting a vaccine. And in kids, that's a really heightened response. And that causes your blood pressure to drop. And the result of that is fainting. So again, it's not due to any of those one vaccines individually. It's really just due to that age range that they're getting the vaccine and just due to your normal physiological response to getting nervous and anxious. So when people know that and saying, oh yeah, it has been associated with this vaccine, but here's why, we'll let them know and feel a lot more confident in that one. And then to really address those other concerns that were brought up from typically a parental side is education. Having the appropriate education for the patients, describing terms that they can understand and that they actually know will help them out a ton, making sure that they feel listened to and not just directly spoken at. That makes sure that you have that good patient-provider relationship, that they feel like they can trust you and actually take your recommendations instead of feeling like, oh, this person's just being a jerk. I don't care what they have to say and moving on from that. Really taking the time with them. So that's why we had that slide about how long do you spend with patients talking about vaccines? Because a lot of times it's not just as easy as, oh, you're due for this vaccine, let's get it taken care of. It comes down to a lot more discussion. And just because they say no the first time around, doesn't mean that's the end of the story. Bring it up again. Definitely let them know that they are still due for it, that you strongly recommend it to them. Give them those reasons, tell them stories, make sure that they really understand why you're talking about this vaccine. And then, yeah, we'll close it out. So
Yeah, so I think some of the main takeaways that we would like for you guys to have from today's, our section at least of today's presentation is trust, having a relationship with your patients so that they trust what you're saying, spending the time to educate them on not only the benefits of getting the vaccine, but even like some of the stories we heard today from Christina and Thomas, stories from survivors and like adverse effects associated with cancer treatment, and then how the effects persist even after you've cured the cancer and you're moving on. Thomas is 10 years down the road and he still says that he has some issues with post-cancer treatment or whatever. Also keeping in mind the ARM method and the SHARE method, and just being open to listening to what they have to say. And if you don't know the answer, telling them, let me go look it up for you, instead of just answering without knowing.
Yeah, and really it's also just finding what works for you guys in your practice, finding out how you can best manage recommending vaccines and what overall is more responsive for your patients. Heard, and then we'll go ahead and take any questions.
Thank you, everyone. Sarah and Tanner, you can go ahead and stop sharing your screen, and we'll go ahead and open it up for questions for everyone. So if you have questions for Christina or Thomas, Sarah or Tanner, please ask them in the chat here. We'd love to take them. I know we did have some questions come through. Madi, I'll let you go ahead and ask those. I think they were for Christina and Thomas that you had on there.
Hi, yeah, this question is for anyone who would like to answer. What message would you share with young adults who may not understand the long-term benefits of getting the HPV vaccine?
I think that can be for anyone.
Go ahead and repeat that again. I'm sorry, I wasn't paying attention. Something
No
about
worries.
long-term.
Yeah, well, what message would you share with young adults who may not understand the long-term benefits of getting the HPV vaccine?
Well, I would try to give them educate them by giving them the information, the stats that are out there. You can go out to Google, and also they should talk to their own primary care doctor and reiterate the importance behind why it is. Now, my boys are young adults. They're 25 and 27. They even now pass on to their buddies who have kids, or even their buddies in their age group, about this kind of stuff, because kids are very sexually active these days. And if they're not informed and they don't know, they should talk to their primary care doctors, and they should get the information as to why they should get it or not get it. It's a tough call on their part, but I always stress that you're better safe than sorry. Bottom line.
Yeah, I think an important.
Oh, sorry, go ahead.
Okay, thank you. I just think an important thing to keep in mind is that when we talked about those HPV infections, the ones that are uncontrolled in cancer are caused by cancer-causing serotypes. Those cancers develop decades down the line. So it may not be when you initially get the infection. And so I think that's a really important thing about the vaccine, and conveying that message to people who do get it, is that decades down the line, you can have adverse events occur because of HPV infection, and you may not even, correlate the two events together. So that is a really long-term benefit of getting this vaccine, is preventing cancers decades later. Like Christina said, it wasn't until later in life that she got her cancer diagnosis.
That's what I stressed to my boys when I said, well, look what happened to me. 30 years later, I come down with a HPV related cancer. I says, you could use that as another way of telling your buddies and their buddies' kids to get vaccinated.
I could bring it to a lower level. I like Fritos. They're not good for you, but I like Fritos, right? So I couldn't taste what a Frito tasted like for like 6 months. So whatever your favorite food is, if you like to have a Starbucks coffee, or you like to have whatever you like to have, long-term wise, you could avoid that by just getting the vaccine, right? I mean, could you imagine not tasting Fritos for 6 months?
Or a year,
Or
being
or
able
a
to
year?
eat something.
Actually, Christina, that's a good point. I think we're lucky because we got our taste buds back. Some people don't get their taste buds back.
My taste buds are
So
not like they used to be, though. I still
oh,
don't
there
have,
you go. Yeah,
I still don't have the
yeah,
taste that I recall having, especially like a nice juicy
yeah,
steak. No, and I'm over 4 years out. The dry mouth and the lack
yeah,
of taste, like you're saying, Tom, it's
yeah,
horrible.
yeah,
Or trying
yeah.
to eat
So there,
something like popcorn after having this treatment. You can't,
yeah.
it took me 3 years before I could even try popcorn. So I
Oh,
still
I
have
forgot to finish
experienced
the
stuff.
story with the honey. Can I finish the story with the honey real quick?
Sure, go ahead.
So my we have a friend that was a radiation therapist, and she said, "Hey, I recommend putting local honey. Did you do this, Christina? Putting local honey on the wound in your mouth, because I think I started talking about the pain. So every time my wife would drive me to the to the hospital to have my thing and get this little honey packet out and stick the honey in the back of my throat, I can't eat honey anymore. I hate it.
I can't either.
I can eat Honey Nut Cheerios, so if that's your thing, that's fine. But anybody, oh, I made a nice little honey. No,
No,
can't do it. Can't do it. Sorry.
the artificial
Oh, you
honey
like
is
honey?
different. Yeah.
Just get this. Just get the vaccine. You can avoid all these problems that Christina and I have, right?
I see we have actually someone with their hand raised, Jackie Cheney. I'm going to allow you to talk and ask your question.
Sorry, no, that was okay. I'm not sure how I did that, so I apologize for that, but I enjoyed the session. Thank you.
Okay, well, I'll lower that hand there real quick. I did have a quick question for Christina and Thomas. You talked at the very beginning before we came on about April being Head and Neck Cancer Awareness Month. Can you talk a little bit about that? I know that is a little bit beyond just HPV, but I was wondering if you could tell us what you've seen done or other exciting things. I just wanted to allow that plug for that awareness month to be in there.
I always defer to ladies first. So Christina, go ahead.
Oh, you always gotta let me go first. Okay. Well, the Head and Neck Cancer Alliance Awareness Month is April. That's where, we try to reach out to individuals about head and neck cancers, as well as how to get information on it. And the Move-a-thon is, like I said earlier, it brings people together to help support us needing treatments and things of that nature. Because, like other cancers have a lot of fundraisers, the breast cancers have theirs and so forth. The Head and Neck Cancer Alliance does this Move-a-thon, because for me, I was really glad to start in doing it when going through my treatment. What helped me is, like Thomas says, is you're fatigued, you're tired, you're wiped out. Radiation just wipes you out. And I had to move. I got moving by just walking around my living room in my house, just to give me some sense of, strength too. And I said, oh, I need to keep moving, because if I don't keep moving, I'm not gonna get through this. It's mind over matter too, in some respects, but it also was for the emotional side as well as the physical side. And then doing the exercises on my neck that I still do to this day to keep those muscles and the fibrosis from getting worse. So when they did this Move-a-thon, I'm like, hey, this is great. I'm going to get moving with them, because it helped me feel better. And I was sharing that with others, like, hey, we need to keep moving. We need to get people involved, and they need to be made aware that the Head and Neck Cancer Alliance has this fundraiser, but they also have other resources out there for people who need help. So that's our month. Our month is the month of April.
I think just to quickly add, and I know we're running out of time, but it's also kind of the front end providers to do the in-personal screenings. I don't know if it's on the website anymore, but one of the founders, Dr. Terry Day, down here in Charleston, had put up a video that kind of showed how a frontline provider could kind of check, even though my lymph node was very, very swollen, it doesn't necessarily mean that's going to be swollen there. So both a physical check of the neck, which is something that frontline provider would do, and also then do the oral. Again, my tumor was on the base of the tongue in the back. It was not visible, but there are other cancers that are visible, and I'd hate to say it, because you know, I think I mentioned when the doctor said, I got good news and I got bad news. The good news is, you're HPV positive. There are people that are diagnosed with HPV negative cancers, and those are a different animal. And I've actually had somebody from high school pass away from that. But again, that screening would indicate if that person chose to chew tobacco or whatever, smoke, whatever, maybe might be a different situation. Although we as HPV positive would need to be careful also with smoking, and I don't smoke and all that. But with that said, it's again getting that frontline dentist whoever it may be that is in the medical field that can do the check. So that's part of it as well. So I'll close.
One
on
other
that.
quick thing too is the Head and Neck Cancer Alliance also offers screening programs for healthcare providers to do screenings.
Yeah.
We have a link out there to and it's also month of April is what they like to do it to bring awareness to it, but they can do it at any time. We have links to
Right. Anytime.
that as well.
Anytime.
Well, thank you, everyone. I know we're a minute past 1, but I want to thank Christina, Thomas for opening up your time and sharing your story with those of us, and really just that the impact that cancer had on your lives, and glad you both are so many years out, and hope that trend just continues. So truly appreciate you taking the time out of your busy days and schedules to share that. Same thing with Sarah and Tanner. Thank you so much for sharing your stories of when you've talked to people and just your knowledge, especially with that pharmacy perspective. Truly appreciate that. For everyone here, I want to thank you for listening in. For those of you who are able to stay with us as we are ending, just a reminder, we have our next one on April 15th from noon to 1 o'clock Mountain Time. Dr. Kimmy McGillis is going to be talking about her personal experience with shingles and talking about the shingles vaccine. That'll be kind of interesting to hear them talk about, both sides of that. We will be receiving just an email, just a survey, seeing your opinion, what we can do to make this better. And again, thank you, everyone. And we hope you have a fabulous Tuesday. Thanks.
Thank you. Bye.
Thank you.